Good morning, and thank you for taking the time to join us today. My name is Tracy Lawson, and I am a broker advisor with Cornerstone. I would like to take a second just to thank everybody for choosing to partner with Cornerstone. We do appreciate your business. Before turning the presentation over to Humana this morning, there are a couple of updates I would like to share. Cornerstone's autopilot program has recently undergone a facelift. This program is designed to help you make a plan for your business, your clients, and your family. This program includes a number of components, including a client referral program, succession planning, and retirement assistance. If you would like additional information on our autopilot program, please do not hesitate to contact your Cornerstone broker advisor. Secondly, if you missed our earlier announcement and webinar, we are very excited to announce our exclusive partnership with EB3. EB3 offers you the ability to create a fully customizable benefit booklet for your clients. Again, if you're interested in receiving additional information or you have questions on this program, please do not hesitate to reach out to your Cornerstone broker advisor. Very quickly, before we turn the presentation over to Humana, wanted to let you know that during the webinar, all phone lines will be muted. So should you have questions, please type those in the chat box, and we will address those at the end of the presentation. With that being said, Leslie, take it away.
All righty, thank you. Get my screen up here. Okay, can you see my screen okay?
Yes.
Okay. Hi, I am Leslie Isler with Humana, and I'm really excited to be with you this morning to talk about a Humana solution that isn't new, but we've kind of made a twist on it and are now offering it to fully insured members. So without further ado, we'll go ahead and get started. We're going to talk about On Hand. So we introduced On Hand last year as a level funded premium option, and now it's available for non-community rated fully insured groups. We will also talk about Humana Dental, do a quick review of some of the benefits of Humana Dental, Humana Vision, and then talk about some bonus opportunities that are available to you. As always, as we go through this presentation, if you have any questions, don't hesitate to let me, Tracy, know, in the chat, or after the presentation, you can reach out to your broker advisor, your Humana team, which consists of, again, myself, Leslie Isler, Tyson Brown, who is your inside sales executive, and Casey Badura is your retention executive. And we're all here to help you guys. First off, On Hand, again, we introduced this last year on the level funded chassis. It was really a revolutionary new way to digitally link with a doctor through Doctor on Demand, but not just for urgent care or if you're sick or have an illness. It's for primary care needs. And so there are virtually based primary care doctors. They're board certified through Doctor on Demand. And it was really a unique offering. It was something that we actually came out with before COVID. And then once the pandemic hit, it was actually a really great solution because most people were trying to do their visits virtually. So this will focus on virtual visits. So what is On Hand? Let's just do a little recap, or if you're not familiar with it, we'll talk about, again, it's a modern health plan that uses Doctor on Demand physicians. You do have access to use in-network doctors, and we'll talk a little bit more about that, but the main focus is through Doctor on Demand. So there are unlimited Doctor on Demand visits, whether it's for primary care or for illness, at no cost. So zero cost for a member to use a Doctor on Demand physician with the On Hand product. There's immediate access. So we'll talk about an app where members can immediately access Doctor on Demand. They can get plan utilization details, cost transparency tools. If your employer chooses to have a flexible spending account or a HRA, those balances are also available via the on-hand app. So it's an all-encompassing app that the member would have with connectivity to any portal that they would need. So a lot of people, when I first heard we were coming out with on-hand, I thought, well, how is this going to work? You go to a doctor and they do your blood pressure and take your temperature. So each member will get a care kit shipped directly to their house at no cost. And that care kit consists of a thermometer, a blood pressure cuff, and it's a nice one, and then an oximeter to actually take somebody's oxygen levels. And so the doctor on demand doctor, primary care physician, will prompt the member to report those things as they're going through the visit. There are common labs and prescriptions that are available for a $5 copay. And I'll show you a list of some of those tests and prescriptions that are available a little bit later. There's a concierge service. So members are going to be utilizing doctor on demand primary care physicians, but they may have the need to see a physician in the area. And with this particular product and solution on hand, there will actually be a concierge team which will help them get to an in-network physician. In-person preventive care is covered in full. A lot of people ask about children, babies. We recommend that children under the age of 2 use their pediatrician. And so keep in mind that all in-person preventive care is covered at 100%, and the deductible does not apply to that as we get into this. And flexibility to add a flexible spending account or an HRA account, and then a range of maximum out-of-pockets for employers. I talked a bit about COVID-19 and the fact that we actually came out with this product before the pandemic, but it just, with the pandemic and people really focusing on virtual primary care, it just made this particular solution even more popular. Patients can stay at home, they can meet with their doctor on demand primary care physician and not have to leave the house. So we introduced it via level funded premium product last year, and now it's available in the states you see highlighted, fully insured. So fully insured 100 plus, and also fully insured for the 51 to 99 space. So what does the fully insured product look like? Again, doctor on demand visits, whether it's primary care or acute care, is covered at a $0 copay, and there is unlimited visits, no cost to the member, no limit. You can go as often as you want and call into the doctor and see them. Preventive care, whether you're using a doctor on demand physician or you're using a local physician in the network, is covered at 100%. There are various maximum out-of-pockets that are available for, and when you see NCR, that's non-community rated, just so you know what that stands for. There are various out-of-pockets which range anywhere from $2,000 to $7,900. And then in the 100 place, a 100 plus space, the out-of-pockets start at $1,000 and go to $7,900. The deductible is the same as the maximum out-of-pocket. So once you've paid up to your maximum out-of-pocket amount, the plan will cover in-network services at 100%. It's a 150 plan. Again, prescriptions, it's our RX5 benefit. So members for tiers 1 and 2 would pay $5. And then tiers 3 through 5 would be, the member would pay our contracted amount up to their maximum out-of-pocket. If a member utilizes labs such as Quest and LabCorp, there are select services and tests that are $5 copay, and I'll show you a list of those in a bit. All other labs and other in-person primary care and specialist visits would be the contracted amount up to the maximum out-of-pocket. As you can see, it's ACA compliant and meets minimum value compliance. And this is something that's a little bit different on the fully insured version. Go365, EAP, and all clinical programs are included in the fully insured version. In just a second, I'll show you a side-by-side so we can compare a little bit, but that's something that's different on the fully insured versus the level funded premium. Spending accounts are available. And one thing is member email addresses are required. And not only for this product, but it's something that we're going to be collecting going forward. For a lot of members, it's their main way of communicating with Humana. And so member email addresses for this product are required. Here is a comparison. So again, non-community rated, and then the level funded premium version, and then our ASO version, which I'm not going to go over the ASO version, but as you can see, there's more maximum out-of-pocket options for the non-community rated. Everything else is very similar till you get down to that Go 365 EAP and clinical program. So for non-community rated, fully insured groups, Go 365 EAP and the clinical program are included, which would also mean that our Go 365 discount, and if you're not familiar with that, we give a discount to members once they hit silver status on our fully insured block of business. They get a 7% discount for hitting silver and a 15% discount for hitting gold. That is still applicable for the non-community rated fully insured on-hand product. Again, if you go over to the middle, to the level funded premium, those programs are not included in the on-hand program for level funded. So, okay, you can answer this in your head. Let's recap. Want to make sure we have this straight. What does on-hand for fully insured include that on-hand for self-funded does not? So hopefully y'all are looking this over and going, concierge service included. Preventive care at 100% included. $0 virtual visits included. So on-hand for fully insured includes O365 clinical and EAP is the difference. That is included on the fully insured version, and it is not included in the self-funded version. So our traditional health plans have doctor on demand, but not doctor on demand with primary care visits. So let's talk a little bit about just a traditional plan with doctor on demand and then doctor on demand with on hand. So the traditional plan, most people are going to use that for urgent treatment. You have pink eye. You know, my daughter calls me from college and holds the phone up and says, "Is something wrong with my eye?" That's a situation on a traditional plan where somebody's going to call doctor on demand. But with on hand, it's coordinated continuous care with a primary care physician. Traditional doctor on demand, there is no concierge service. With on hand, if a member does need to see a doctor in the area, say they need to see an orthopedic, they're having knee issues, and the doctor on demand doctor decides that they need to go see an orthopedic or gallbladder issues, they need to see a surgeon, there's that personalized concierge service with on hand that will help the member get to an in-network physician. And they'll help them schedule that appointment. There's really no coordination on the traditional plan beyond you go, you have your call, and they might send you a script in or request a test be done, but there's really not a coordination of care. With doctor on demand, with on hand, the PCP will receive results from any type of referred care. So again, they'll follow up with you, and it'll be that continuous care that you would have with a primary care physician. With the traditional plans, depending on the plan, the member could pay anywhere from $0 up to $56 for a virtual visit. With on hand, unlimited medical virtual visits at no cost. And then there's no care kit with the traditional fully insured plan. And there is a care kit sent, again, with the items you see on the screen to a member who has on hand. So let's talk a little bit about how it would work. A member needs care. They would go to their on-hand app. They could go to a tablet or a computer, something that would have a video access for them to link up with the on-hand doctor. They can actually use the same primary care physician every time that they log in, or if their PCP isn't available, they can speak to one of the other primary care physicians, similar to what you would do with an in-person visit. There is integrated behavioral health appointments that are available with board-certified physicians, psychiatrists, psychologists. So it's not just the PCP or the sick care. There's also mental health care that is available. That's a great thing, too, to be available via doctor on demand. Sometimes it's hard locally to get in with a physician, or people don't want to go out of the house. There may be issues. And so it's really important that that integrated mental health is available within doctor on demand. Then there's also disease management programs and social determinant assistance, coaching and care plans that can be done through doctor on demand. So there's a team of people behind that primary care physician. So let's talk about some member benefits that we've seen. And these are some great statistics. These were from last year, but 92% of the patient's questions or issues with our on-hand product were resolved within that first visit with their doctor on demand primary care physician. Of the prescriptions that the doctor on demand physicians wrote, 73% of the medications for on hand were $5 or less. So they fell into tiers 1 or 2. That's a great percentage. 48% of on-hand members had their visits outside of standard business hours. So the doctor on demand physicians are available 24/7, not just from 8 to 5 or 7 to 4. And if you think about the workforce these days, a lot of people can't get away. They may have only 10 or 15 minutes to talk to a primary care physician. And by the time they drive to the office, wait in the waiting room, have their visit and drive back, they've missed 2 hours worth of work, or 2 hours worth of something that they really didn't have time for. So 48% were outside of standard business hours, which is a great percentage. And then we talked about the mental health component. Just last year between March and April, and I haven't seen updated statistics yet, but I'm sure it's still high, the doctor on demand mental health visits increased 86%. So as you think about employers who may be interested in on-hand can be offered as a dual option for groups. So you can offer a traditional plan, or you can offer on-hand. It's not going to be for everyone. So you want to think about, there are a lot of employers who have people who don't have relationships with primary care physicians, or, they don't have time to, they're manufacturing and they don't have a lot of time to go see a primary care physician, but we still want them to see the doctor and close those gaps in care. This might be a great product for them. Again, you can offer it as a dual choice. Any dual choicing guidelines would apply, but you can offer that, and half the group may want on hand and the other half may want just the traditional plan. Again, some of the employer benefits: the concierge service helps members find an in-network physician if they need in-person care. As I talked about, the virtual medical home, it helps close those gaps in care where somebody may not go see a physician because they don't have time or they don't have a relationship. It's really a modern benefit offering. So if you think about how people are accessing care, and especially since the COVID-19 pandemic, a lot of people and a lot of physicians' offices have gone to virtual visits, even local primary care physicians' offices. So there is an app available. I talked a little bit about that. It would be the On-Hand app, and it does have direct access to a doctor on demand physician. It has access to spending account balances and transparency tools. A lot of great information available on the app. There is an agent launch kit, and I'm going to flip over real quick to. So the agent launch kit is something that you can get from your Cornerstone broker advisor, and it has all of the information that you would need to sell on hand. So it has sales positioning and handling objections, has on-hand brochures, digital versions, it has plan comparisons, and I pulled up one of the things. So if you just click on, the hyperlinks are actually embedded in the PDF, and when you click on it, it'll actually bring up the document that you might need. So that launch kit is available. One other thing I wanted to show you, or a couple things. So we talked about the $5 common prescriptions, and it's not just 2 or 3 prescriptions. A lot of people think, oh, sure, $5. If you look, this is 10 pages. I don't want to make people dizzy scrolling, but there are 10 pages worth of medications that are covered at the $5 level. So rest assured, that's where we got to that 73% of prescriptions filled through on hand were in the $5 level. It's because it's a fairly robust list. And then the common lab work that we talked about that a member can get at a Quest or a LabCorp. Here are some of the common tests. There are 3 pages worth of tests. One of the things that are ran a lot by primary care physicians is this comprehensive metabolic panel that can be ran, glucose, serum, urinalysis. So those are the tests that are available with a $5 copay. And let's go back to the presentation. So again, on hand, before we go into dental and vision, as you think about on hand, think about your employer, think about the audience, the employees, the type of employees. Would this be something that would be attractive to them? If you think about the pricing on this, it's between a copay plan and a high deductible health plan. Clearly, it's not going to cost less than a high deductible plan because there are great first dollar coverages on this plan. So it falls in between there. Okay, Humana Dental and Vision. A lot of this is probably reminders to everyone, but I just wanted to talk about the dental plans that we have available. So traditional preferred plans, you do not need a network you don't have to have an in-network dentist. If you do happen to use an in-network dentist, then that would take away any balance billing. But I have something I want to show you regarding balance billing in a moment, but just our traditional plans that are available. We also have PPO plans with many different out-of-pocket maximums, something that's a little bit different on our plans. Not all people or all carriers have unlimited calendar year maximums, and we do have unlimited on our traditional preferred and our PPO plans. And then we have a preventive plus plan. So maybe somebody is not, new to dental and they just want some coverage for some preventive care and a few basic services. The preventive plus plan would be for them. So why Humana Dental? Humana Dental has some great features that a lot of people forget about or they just don't know about. We have something called the extended annual maximum. This benefit gives a member 30% co-insurance, a 30% benefit once they have hit their annual maximum. So it's not rollover. You don't have to wait to use this benefit. It's available immediately. It means that your coverage never ends. And it's available on traditional preferred and PPO plans. And I have an example in here of how it'll work in a moment. We also have waived preventive services from the annual max rider. This is a great thing. If you have a client or you're trying to win over a new client, this is a great strategy to look at what their annual maximum is. So in a lot of situations, if you have a higher annual max, you can lower that annual max and add this waived preventive service rider and actually give the member a better benefit. And I do have an example of how that would work. So it waives routine exams, x-rays, perio cleanings, if a member needs that, from the annual maximum. And that's worth over $400, just depending on, if you just have the routine exams and the x-rays. If you need perio cleanings, that makes that benefit even greater. Humana covers 4 perio cleanings and 3 regular cleanings as preventive care each year. Periodontics and endodontics are independent options, so you can, a lot of times we recommend you put the perio in basic and the endodontics into major. If you have a crown, you're probably going to be close to hitting your annual maximum. So a lot of times we just recommend that you put that endo in the base, or the major services. Employer sponsored. With Humana plans, in order to get employer sponsored rates, we do it a little bit differently. So a lot of people look at whether or not an employer is contributing. We do not look at contribution, but we look at participation when we're deciding if the plan would be employer sponsored versus voluntary. So as long as a group has 50% or greater participation after valid waivers, that would be considered employer sponsored, and you would get the lower employer sponsored rates, even if the employer does not contribute anything. And then employers can offer a dual choice with 10 or more enrolled employees on dental. A lot of people don't think about this on a dental plan. You know, we do it every day, all day long on medical plans, but it is something that's available on dental plans. So this is a slide. Jim may or may not be my husband. So Jim has periodontal disease, and he requires 4 periodontal cleanings per year. In addition, Jim requires gum grafting surgery in each of his 4 quadrants. And this is going to show you first plan carrier X. And then when I talk about adding some riders and lowering the out-of-pocket max on a Humana plan, what it'll do for the member. So the first plan is a $180.50 plan, standard $50 deductible, $1,500 annual maximum. So the gum grafting surgery, and this is a true figure, $4,000 for each quadrant. So first gum grafting surgery, $4,000. The 4 perio cleanings that are required per year, $500, and annual x-rays, $100. So if you look at the cost of the surgery, with carrier X, the $1,500 annual max is hit immediately, which leaves $2,500 for Jim to pay. But then he has his perio cleanings and his x-rays. That's an additional $600. So his out-of-pocket that year with carrier X would be $3,100. With Humana's plan, again, talking about winning new business or being consultative for your employers, we're going to put in the same $180.50 plan with a $50 deductible. But we're going to save them some premium dollars, and we're going to lower that annual maximum to $1,000. Don't forget, we have the annual extended maximum standard on our plans, which is that 30% co-insurance once a member hits their annual maximum. And then we're going to add the waived preventive service rider. So in the same situation, the gum grafting surgery, the perio cleanings, and the annual x-rays, the surgery is $4,000, and of course the annual maximum is going to be hit immediately of $1,000. Of that $3,000 left, the member's going to get a 30% benefit. So Humana's paying an additional $900 due to that standard extended annual max that's included on our traditional and PPO plans, which then leaves Jim $2,100 to pay. We've added that waived preventive service rider. So perio cleanings, which are considered preventive, and x-rays are covered at 100%. They don't go towards the annual maximum. So in the situation, Jim is only going to pay $2,100 out of his pocket. So not only did we give the member a better benefit, we've also lowered their premiums by taking the annual maximum from $1,500 to $1,000 and adding the waived preventive service rider. So it's a great way to show your employers, that you're thinking about them, you're thinking about benefits, and thinking about different strategies for them. The next slide is actually my own EOB. And the reason I show this is a lot of times people get hung up on networks with dental plans. And with medical plans, absolutely, you want to stay in the network. If you don't on a medical plan, there can be some huge balance billings that happen. But my dentist is not in the network. I have Humana Dental, and this was from last fall, August, I had my regular cleaning. So you can see my dentist, Natalie Lawson, who is in with Carl Lutz. I went for my preventive services and it was $245. And I wanted to show you, I know this is busy, but if you look at the top, it's under claim receipt, it says provider Natalie Lawson, out of network provider. So they're located in Crestview Hills. I had my exam, my prophylactics, I had x-rays done. You can see that $50, $82, $25, and then several $22 charges. And I was not billed for any of this. Humana paid the full amount. So I'm not going to say balance billing never occurs. It can occur. But in this situation, my dentist is out of network and I do not get balance billed for my preventive care. Humana does pay that. Okay, on to Humana Vision. Few things I want to point out on Humana Vision. We do have a $100 plan, a $130 plan, $150, $160, and $200. We also have materials only plans at the $130 level and the $160 level. So if you do happen to have an employer who has a routine eye exam covered under their plan today for whatever reason, you can purchase a materials only plan. Some of the unique features that Humana has, and I love this benefit, is retinal imaging is covered up to $39 automatically on our plans. You can purchase a rider to have a retinal image covered at 100% no matter what the cost is, but generally $39 will cover it. I go to Wing Eye Care and my retinal image each year is $35. So it's more than enough to cover it. And if you're not familiar with a retinal image, you put your eye up to the screen and it takes a picture of your eye. And then your doctor has that for comparison purposes over the next several years. I actually had a spot in my left eye. They called it drusen. And the doctor, optometrist, said, I'm glad we have a retinal image because we can actually view that image year over year to see if it changed. So that's something that's different on our plan, is that retinal image coverage. Also, premium anti-reflective coatings and premium progressives. We have copays for most of those buy-ups. I have glasses that are have crystal lenses and anti-reflective lenses and coatings, and those are all covered with a copay. Some carriers just give a discount, but the majority of ours have a copay associated with those buy-ups. And we also have an Exam Plus. So if you have an employer who does not want to do full eye coverage, they can actually cover an exam with a copay. And then there are some standard lenses that are also covered with copays and some discounts that are available. And we talked about Humana Vision and what makes Humana Vision different. The retinal image covered up to $39. Diabetics receive additional care on our vision plans. So not only do you get a retinal image, an exam, diabetics get 2 of everything each year because we want to make sure, again, Humana is about health and wellness, that diabetics are getting their exams and getting them in a timely manner and as often as they need them. Fixed costs for most lens upgrades, talked about that. The network that Humana uses is called the Humana Insight Network, and there are thousands of retail chains and independent optometrists nationwide. And again, just as with the dental, our vision plan, we look at participation when we're deciding if the rates will be employer sponsored versus voluntary. So even if the employer is not able to contribute to the plan, but they have 50% participation, then we would give the employer sponsored rates. We also have something that's new, special offers that we have for our members each year. So this is for 2021, our special offers. There are a few examples that are currently listed there. So additional $25 off when using your vision insurance at Target Optical. $25 towards a complete pair of glasses or prescription sunglasses at Pearl. So these are additional benefits in addition to the actual, coverage that you have on the plan, they would give you these additional benefits if you go in there and use your Humana vision benefits. Bonus opportunities. We always have great bonus opportunities that are available. I put the bonus opportunities. We have bonus opportunities right now. These are what's available August 1st, since we're already at the end of June, August 1st through December 31st. So the first one is for large group employers, and you can get a bonus starting at $5,000 for each employer with at least 100 enrolled employees. Level funded premium on the bottom left, 3 to 4 cases sold during that time frame is a $5,000 bonus, and then it's accumulative. So you can earn some great dollars by selling level funded premium. Again, on hand, which we talked about, is available fully insured or as a level funded product. So you could sell on hand level funded premium and get a bonus by selling multiple cases. And then we always have a bundling bonus. Have to have at least 5 enrolled, but if you bundle dental and vision together, it's a $500 bonus. It's a $1,000 bonus for dental, vision, and life. And then if the group is 100 plus, it's a $1,000 bundling bonus for dental and vision. Okay, and that ends my presentation. Tracy, did we have any questions?
Just a real quick question, Leslie. Will we be able to share a copy of the presentation?
Absolutely. I will send it to you right after this, and I will send you the agent kit also.
Okay. All right. Perfect. And I think that is all of the questions that we have. I did neglect to mention at the beginning of the presentation that the webinar has been recorded. So within the next couple of days, you will be able to find a recorded version out on the Cornerstone website at crnstone.com. So if you want to go back and re-listen, or if someone in your office maybe didn't have an opportunity to join us this morning, it will be available. And then again, if you have any questions, please do not hesitate to reach out to your Cornerstone broker advisor. So we do appreciate everybody's time this morning, and have a great day. Thank you.
Thank you for your time.